nonprofits and the people behind them. Casey Cares is the intersection of the nonprofit and profit communities, making Kansas City a better place to live, work, and play. This Casey Cares segment is brought to you by the Ewing Marion Kaufman Foundation, www.kaufman.org. I'm Ruth Bombigas. Health costs continue to rise, and the current state of inflation is making it even more difficult for people. People who are uninsured or underinsured. It was already challenging to keep up with rising costs of things like medication. Now, living in poverty makes things even worse, as well as a lack of access to pharmacies and good medical counseling. National statistics indicate that 20 to 30% of prescriptions written for patients go unfilled. 50% of the meds they should be taking for chronic conditions like diabetes and heart disease are taken incorrectly. Unmanaged diseases cost our healthcare system more than $100 billion annually. Closer to home in our metro area, Wyandotte County has the highest percentage of people living in poverty, which means fewer meds are making it into the hands of the people who need them, or if they make it, they don't take them, they don't have the right directions, etc. Well, John Yost spent years in the pharmaceutical sector before pivoting into the pastorate at Church of the Resurrection. John wanted to see things change, and that's what he's doing with Pharmacy of Grace, a nonprofit located in KCK, helping patients afford their medication and providing one-on-one counseling so patients know about their meds and the proper way to take them. John, we welcome you to Casey Cares.
Thank you, Ruth. It's a pleasure to be here.
This is a huge topic of conversation, just in general healthcare. Can you share with us a little bit of your path to creating Pharmacy of Grace? I think it's such an interesting story for our audience to hear.
Well, as you mentioned, I spent many years in the pharmaceutical industry. I started out at pharmacy school, practicing pharmacy in the community sector, then moved over into the pharmaceutical industry, and I did a wide variety of jobs and actually a wide variety of specialties. And my last 5 years, I went from the commercial side to the medical side, and I was in HIV and rheumatology and very subspecialty orphan spaces. But throughout all of that, what I learned is that there's many people that struggle to get even the basic medications. If you have high blood pressure, if you have diabetes, whatever that may be, they struggle. So at the end of my pharmaceutical venture, I felt a call and I moved into a pastor role with Church of the Resurrection. And I worked in the missions department. And my job was developing mission trips for people to go on in the US to give them that experience, that taste of going and serving someplace outside their comfort zone. So that led me to Columbus, Ohio. And I literally stumbled on a postcard in the pastor's office in Columbus, Ohio, and it said Charitable Pharmacy of Central Ohio. And so I just started asking him questions, and finally he said, "Are you interested in seeing this?" And I said, "I am." So I went there, and it was an amazing operation they had. They were serving primarily homeless population. And I returned twice just to get a better feel for it, and then came back to Kansas City working still at Church of the Resurrection. And it just wouldn't leave my mind that maybe we needed that in Kansas City. So I started trying to figure out if we did and researching it. And then 2018, we actually formed our board and we filed for nonprofit status. And we were able to achieve that early 2019, the 501c3. And then, of course, early in our venture, COVID showed up, and that really stopped us. We paused for almost a year, and then we started getting momentum again, had funders, and led us to a soft opening July 18th and then a grand opening August 18th. So we've been open, really going since August 18th.
That is determination and dedication, I have to say. No easy route.
No, it was a journey, and I you know, the board, we talk about how many times we'd have the conversation, well, can we move forward, or is it time not to move forward? And every single time we decide, well, we'll try this next approach and we'll continue to move forward, and uh, until the day we actually opened our doors. And it's if you saw the space, it's actually an amazing space. It's patients walk in there, it's a place like they've never seen as far as the pharmacy goes. And we have in our waiting room, it's a welcoming space, and we have local artists that are rotating artwork on our walls, so that our goal is patients walk in. And if you think about walking into a pharmacy, if you have a prescription, you've just been to the doctor, many times you're really not in that great a mood because you may not be feeling well, or they just told you something you didn't want to hear. And so you walk into an environment, most of the pharmacies people walk into are incredibly busy, and there's so much activity going around. And you know, their whole goal is just to get in there and get it and get out. So we wanted to change that, make it a welcoming space. And you know, where we're at in Wyandotte County, there's so many things that people have to overcome. Like right around where we're located, it's up to 30 to 40% uninsured. And as patients walk in, the primary language has been Spanish, but we've had Swahili, we've had immigrants from Afghan, we've had a dialect from the Congo that was no one had ever heard of, but fortunately our translation service had, and so we could speak with that patient. So yeah, I just think about, I worked a health fair where it was Telemundo Health Fair, and it was all Spanish speaking from the stage and everything. And I sat there thinking about, this is what it's like to walk into Walmart or CVS and not speak a word of English and not know what you're supposed to do, who you're supposed to talk to, where to go. And so we're trying to break that barrier.
Talk a little bit about how your whole approach and targeting in on your, I would guess, say your main clientele.
Sure. So we've learned, of course, you learn so much as you're going along. Then once you open, you learn more. But our primary focus, if you look at our mission, purpose, and vision, we are trying to increase accessibility for the uninsured. That's our focus, and then the underinsured also. But so our primary clientele, and it's actually already working out that way. I think we're 75 or 80%, maybe even higher, uninsured patients so far. So the patients that we're targeting are those patients that are typically 18 years to 64. That's the age group that there's no Medicaid and there's no Medicare Part D. So if they don't happen to have a job that provides insurance, they're uninsured. And so we have people walking in and in Wyandotte County, unfortunately, it's 14% of the population is diabetic. So that's a huge, I mean, it's a huge issue, because if you're a diabetic, then you also typically have high cholesterol, you have hypertension. I mean, it's just it's called metabolic syndrome, and that's what happens. So the population that we're targeting is primarily the uninsured. And so we have a great nonprofit we work with that provides a lot of chronic medications that we can get at a nominal price and pass on to them. The other group that is in our mission is the underinsured. And I tell people, you don't know if you're underinsured until it happens to you. And so you walk in and they say, well, here's your medication, your copay is $200. And so at that point, there's just a lot of people that just can't pull $200 out of their pocket and pay. So that's what we're trying to do. We're trying to increase, number one, access to medications, and number two, the ability to have available medications each and every month, because if you might be able to get the medication once in places, but it's that ability to get it every month so you can manage your disease.
How do you do that? I mean, medicine is medicine and the cost is the cost. So how are you able to do that versus, let's say, as you say, a Walmart, a CVS, a Walgreens pharmacy?
Well, we're the only, that we know of, the only freestanding charitable pharmacy in the state of Kansas. And what that means is we're a 501c3. And so we can access organizations. The primary one we get donated drugs from is Dispensary of Hope, it's called. It's a nonprofit out of Nashville, Tennessee. About 60 pharmaceutical companies donate to them. We pay them an annual fee, and then we can order what we need for a year, and then we have to pay that fee again. So our medication that we get is not free, but it's very nominal. And we charge a nominal price to patients. So I'll give you an example. Patient came in, was a diabetic and needed insulin. They'd gone to Walmart, I think, or Walgreens, one of the two, and they got a price on it. It was going to be $2,500. Of course, they could not, pay for it. And they had heard about Pharmacy of Grace, so they came in, and we have what we call a Grace Meds program, and that's if you're 200% below the poverty level. So that patient qualified. So we priced out the insulin, and the doctor wrote for 4 or 5 boxes. That's why it was so expensive. It was a lot. And so our pharmacist walked out and said, well, this will be $10 for you. And they almost started crying because they hadn't had insulin for so long. They just couldn't afford it. So, it's very emotional for the people who work there and for the patient. But so that's how we do it. And the beauty of Dispensary of Hope and the blessing is that the Lilly company, Eli Lilly, they donate all their diabetic products to Dispensary of Hope, which gives us access to it. So that one donation from that company was really a game changer for us and for any other charitable pharmacy in the country. So that's how we do it. It's from there. And then for the underinsured, so if let's say you're 400% of the poverty, you're actually making a decent income, but you may not have any insurance.
Mhm.
So they come in, and so if it's a generic product, we will, our pharmacists will price that out, and they buy the best price drugs they can give, and then we'll give them a significant price break over what they'll typically get. Our prices usually will be better than you hear advertised for Good RX and that sort of program. So we're better than that on generics. But the challenging one is when they get into specialty drugs and they have no insurance, but they're not 200%. That's still a challenge we're working on.
This is just fascinating how this all works. And I'm being so educated, which is wonderful. and the things that we who can take for granted when you go pick up your medication and you don't realize how tough it is for somebody who can't get very necessary things that they've got to do. Can you share with us a little bit your staff? Who's part of this great kind of little miracle in KCK?
Sure. We have Dr. Mike Fink is he's the pharmacist in charge, and he's got over 20 years experience, and he's a very innovative person. He's just brilliant, and his heart is totally aligned with our mission. He's frankly, Ruth, people have asked me, why am I doing that? And I tell them it comes from my faith. It's very simple. It's love your neighbors as you love yourself, and be the hands and feet of Christ. And so Mike believes in that as much as any of us do. And then Sandra is our amazing pharmacy operations manager. She does all the behind the scenes filling of the prescriptions, dealing with supply and all that sort of thing. And then we have Kelly, who's our hospitality and she's bilingual. She's an incredible interpreter with Spanish. So and because at this point the predominant language is Spanish, she's such an asset because she's incredibly friendly, and she just makes people feel at ease. So that's really our staff. And then we have Andy is a PRN pharmacist. She works here sometimes when we need her. And then we have 4 pharmacists on our board. And so several of us have gone in just to help out some, but fairly small staff, but our volume continues to grow. And so as we get busier and busier, we'll probably, we already know we'll have to add more people just to support the mission.
What kind of hours are you open? Because I would imagine a lot of your clients or your customers are folks who may be working and can't get there.
We are open right now 8 to 4, and they take a 12:30 to 1 lunch. And it's and we know that there are people that can't get there, but the clinic that's right beside us, Mercy and Truth, where a significant number of the patients come from, they have similar hours, but that's all the staff we have right now. So as we move forward, we'll probably figure out how to make those services available for people working. But right now, what usually happens if they fill it, they're in there, and we get the prescription, then they would either come by early in the morning and pick it up before they go, or there's already been a couple times that Mike's waited till somebody came to get their prescriptions.
And how are people learning about you? You mentioned you've got a clinic right next door.
Right.
But how are you spreading the word?
Well, we've been fortunate to initially get a lot of publicity from 41 Action News did the first piece on us, and then Fox 4 and 41 came back, and then we've had a couple radio spots, and just in the Pitch had an article on us. We've had random very appreciated publicity out there. And then we're just kind of boots on the street, going out to organizations around us. Anybody we can think of who might have patients in need, we're trying to contact them. And we're actually have been talking about how to develop volunteers to help us do that, because we're all humans, unfortunately. And so you hear about something once, then it may go to the back of your mind. So you may have to hear about it 5 or 6 times before you really say, oh yeah, I remember there's that pharmacy over there that can help. And even today, like, I'm going to meet with a group of pastors in Wyandotte County just to let them know about it, because people walk into their pastors and say, hey, I lost my job. I don't have insurance. I don't have money. I need food, the whole thing. And so a lot of times they're right in front of people that have a lot of needs. So we just want to make sure they know we're there. So to long answer to your question, we're just really reaching out to every organization that we come in contact with.
All right. Well, so we're going to seize this opportunity. Where can people go to find out all the information about you or to volunteer? It sounds like that's something you're trying to develop.
Right. We have a website, pharmacyofgrace.org. They can go on there, and there's the phone numbers on there, and there's an email address. And if they email that address, our pharmacist in charge gets that email, or they can call in to that number. If they need prescriptions, it's right there on the website. And so if you want to volunteer, just email or call us, and we will work you into the most appropriate area.
You'll find a place for them.
That's right.
We're talking with John Yost. He is the board chair for Pharmacy of Grace, this great operation in KCK, helping underinsured and uninsured folks get medication they need. But you're also doing one-on-one counseling. Talk a little bit about how that works and how you encourage people to sit down and let's talk.
I'd be happy to. And so I don't forget, I just wanted to throw in one other thing related to that question you had before. Another way you can actually help Pharmacy of Grace is if you have insurance, get your prescription filled with us. And because every prescription we fill helps generate a little revenue for us, which helps our mission. So I just want to throw that out. People that maybe don't have the skill to really volunteer in a pharmacy, because unfortunately you have to have certain skills to actually help there. But a lot of people have prescriptions that can get filled. So if they're in the area, we appreciate that too. And we do accept all patients. It's not just uninsured, underinsured. We accept commercial insurance, Medicare Part D, whatever. So we're a full service pharmacy, just like any other pharmacy. But to go to your question you just asked me, it may be the most important thing, because what I learned in the pharmaceutical industry is that the most expensive drug is the one that's not taken. So, it's just like driving down the road, throwing cash out the window. I mean, think of it like that. If you get a drug for something, whatever it is, and you don't take it correctly, you just wasted all that effort, all that time. I tell people that a lot of reasons why we do one-on-one. The classic situation, which is a pet peeve of mine, classic situation, you go in and pick up your prescription at almost any pharmacy, and someone's sliding the bag across the counter to you and said, "Do you have any questions for the pharmacist?" And 99% of the time we say, no questions. And the reason you say that is there's a line behind you, you're in a hurry, and so you don't want to take the time to talk. Plus, you don't want to talk and all the people that are standing around you. And the second thing is most people don't know what question to ask. So that's not a question that should ever be asked, but it's almost asked every single time. And so we don't ask that. We talk to the patient. So our goal is that every patient will know why they're on the drug, what it is, how to take it, and most importantly, if you don't take it, what happens? And so those are all very important things for patients to know. So that's going back to the data that you quoted, that half the drugs patients get are not taken as prescribed. I mean, that's really shocking that we have educated people, and you think about people that can't speak English, can't read English, and how is their ability to take what they're given if they don't understand it? And then we have people that are completely educated and they can read it and they still don't take it as prescribed. So there needs to be, and it's understandable, because you think about a day when you go to the doctor, it's you sit there, you wait, you get in, you may wait in the room, and then they talk to you. And if something's going on, they have a whole list of stuff they tell you. And then, oh, by the way, I'm sending your prescription over to XYZ pharmacy. And you get there and you think, now, which one's which? And maybe if you have a couple of them, what's this one for? And well, I'll just read the bottle. And then you look at it, maybe you don't. You get home and you forget, oh, I was supposed to take that. Oh, I forgot it. So you just did not take it as prescribed because you didn't take it, you forgot. And that's normal. So you asked me why we're doing that. I think that maybe the most important thing in the United States is that one-on-one interaction with the pharmacist, because that's really their job. That's their clinical skill set, is to help somebody understand how to take something and what it's doing for them, and then what's the positive or negative outcome if they do it or if they don't. And then so that's what that's why we have the one-on-one counseling room. If you walk in the pharmacy, we have, as I said, it looks unlike anything you've seen. There's 3 rooms. There's one room that's big enough for a family, and then there's 2 rooms that are more one-on-one or one-on-2 or 3. So and in each room, they've got screens so that the interpreter, or we have an interpretation service that we can access, and it's got 300 languages. So we're set up to counsel.
You're doing amazing stuff. Everybody should ask their pharmacist if you don't know what you're taking and why you're taking it. From this pharmacist to all of us, ask the question. And if you come to Pharmacy of Grace, you'll be able to do that.
That's right.
What would you say? So you started this pre-pandemic, then the pandemic hits and yada, yada, yada. What would you say is the biggest lesson learned starting a nonprofit and now it's up and you're running and you're meeting mission?
Biggest lesson learned. I think the biggest lesson learned is that it's a lot more complicated than you anticipate. There's a lot of, and our model is a very complex model. If you look at every pharmacy out there, CVS, Walgreens, Walmart, they have one inventory. They only have to worry about one inventory. Ours is very complex because every source of donated drugs, so Dispensary of Hope has to be physically separated from every other one. We're in the process of getting donations from several major companies like Pfizer and Merck. When those come in, they have to be physically separated. And then we buy from a couple different wholesalers, we keep those separated. So, we anticipate we'll have 5 or 6 different inventories that have to be kept separated, and you can't borrow from them. You're supposed to keep them all separate. And so that's just complex situation. Then we have pricing, nominal pricing, but still pricing for 200% below the poverty level, 100% below the poverty level, for underinsured, for people that have insurance, Medicare Part D, Medicaid. So it's, fortunately, we have excellent pharmacy software. But as far as I think that's really it. The lesson learned is that it's probably going to be more complex and more challenging than what you anticipate, even if you do a lot of research and you kind of know what you're doing walking in.
It's got to be rewarding for you, though.
Oh, it is. And people, when we had our grand opening, they're saying, "Oh, you must be feeling so wonderful now it's opening." And I said, well, it's almost like a surreal experience. You've worked on it so long, and all of a sudden it's here. And so now a few months later, it's really soaks in when you see the patients in there and you're able to help people. And, we keep track of, pharmacy generates all kinds of data. So we know how many patients we've seen, how many uninsured, how many Medicaid, Medicare, we can look it up and find out anything. And then, so we know that we're serving mostly uninsured right now. So that's when I start getting excited. I see people coming back for their refills, and their blood sugars controlled. They're just doing better than they were. I'd say one of the first patients we had, the best example, she was interviewed for a TV spot with us. Well, the night before, she went in the hospital because her blood glucose was 600. Its normal is less than 100. So she was in the hospital and she showed up for this interview. She couldn't speak English. She was here. She had a home. She had a job. She'd lost her home, lost her job because she was sick. So now she's on insulin. I think she takes 7 or 8 medications. She's on all of them. She's been on them now since July. And she now, I think, has a job. She has a place to live. So she's starting to just, get back on her feet and be able to live. So that, to me, that's loving your neighbor, giving them a hand up so that they can do what we all try to do. Just get out and live your life, do what you want to do.
John, thank you so much. Pharmacy of Grace, check it out. Doing great work in our community.
Thank you, Ruth.
You bet. Thank you for joining us on Casey Cares, Kansas City's nonprofit voice. We're produced by Charitable Communications. This segment was brought to you by the Ewing Marion Hoffman Foundation. If you'd like to be a guest on Casey Cares or Underwriting Opportunities, check out our website, caseycaresonline.org. You can go see all of our webcasts right there. Spread the love and find us on Facebook and Twitter at Casey Cares Radio and on Instagram at Casey Cares Online. And catch us Saturday mornings at 8 a.m. on ESPN 1510 a.m. 94.5 FM. Thank you for joining us on Casey Cares.